In this section, we want to talk about how to perform the Allen maneuver. What is the Allen test and when is it performed? The Allen test is done to assess the adequacy of blood supply to the palm. As you know, when the brachial artery reaches the elbow, it divides into two main branches, the ulnar artery and the radial artery. The ulnar artery runs along the inner side of the forearm and reaches the little finger, while the radial artery moves laterally toward the thumb. Both the ulnar and radial arteries form the palmar arch in the palm and supply blood to the fingers. Therefore, if either of these arteries is damaged, the other artery can supply blood to the palm and prevent ischemia and injury to the palm. So, when do we perform the Allen test? When we are about to perform a procedure on the radial artery. For example, in patients undergoing CABG, or in patients for whom we plan to perform angiography through the radial artery, or even simpler procedures like ABG or blood gas. This can lead to injury of the radial artery. Therefore, if the ulnar artery is not strong enough and cannot provide adequate blood supply, if your radial artery is damaged, the ulnar artery won't be able to supply blood to the palm, and the patient's hand will be harmed, become ischemic, and may even become necrotic. So how do we perform this procedure? To perform the Allen test, we first firmly press both the radial and ulnar arteries. This causes the arterial blood flow to the palm to be disrupted, and then we ask the patient to open and close their hand tightly several times. Doing this causes the venous blood in the hand to be drained as well. As a result, the palm becomes completely pale. All right, that's enough. In the next step, I release the pressure from the ulnar artery, and as you can see, the patient's hand, which was completely pale, regains blood flow and turns pink again in less than 2 or 3 seconds. This indicates that the ulnar artery is completely healthy, and in this patient, procedures such as radial angiography, ABG, or harvesting the radial artery as a graft are permissible. So, if after performing the Allen test, blood flow returns and the palm turns pink again in less than 5 to 7 seconds, this is called a positive Allen test. However, if it takes more than 7 seconds, this is referred to as a negative Allen test. And in these patients, performing radial angiography or ABG from the radial artery is prohibited. There is another term called the modified Allen test or modified Allen's test, in which, in addition to performing this maneuver, we also use pulse oximetry for these patients. That is, we connect the patient's finger to the pulse oximeter and also monitor for any drop in arterial saturation. If you watched this video and found it useful, please like it and share it with your friends. And if you don't want to miss future videos, be sure to subscribe to the channel